Okay, so far with regard to the research project, I think lahat naman nakapag-submit. So, hintayin nyo na lang. I will be grading them one by one. Okay? So, we will start na muna with Module 7. Then I heard from other sections, hindi pa kayo nakakapag-exam kay Doc Christoph, no? For finals. Next week pa ata ang start. Tama ba? Okay. So, can everybody see the screen? Okay. So, for today, we will be discussing about the binocular vision anomalies. So, we have discussed na about the development of vision, the maturity of vision milestones, and the EORs. I think even Dr. Christoph uh, discussed to you about hypertropia, neurological disorders, even yung, I'm not sure if even amblyopia and myopia is na-discuss niya sa inyo. For now, I will be discussing the binocular vision anomalies. This is just a brief discussion since I am assuming na nakapag-bino vision subject na kayo diba? Last semester. So this is just a review na I think you will need to know before we proceed for Pedia 2 next semester. Okay, so binocular vision. So this is the system of sensory motor cooperation between the eyes. So vision is not just reliant on the motor part or yung sensory part lang. Both sensory and motor works hand in hand for us to have binocular vision. Hindi lang porke healthy yung eyes, okay na tayo. Dapat even yung sensory part natin, yung visual integration or yung visual processing natin, it should also work fine for us to have the binocular vision need for our daily lives. So how do we attain binocular single vision? So I'm not sure if I've discussed it before, but there are 3 steps for us to attain binocular single vision. First is the bifoveal fixation or our simultaneous perception. So dito, this is the right eye sees one image and the left eye sees another image, both of them looking at the same target. So dapat both have fixation. Then once there is fixation on both eyes, there will be fusion of the images coming from the right and coming from the left eye. So mag-fuse dapat to form a single image. Once there is fusion, then magkakaroon na tayo ng stereopsis or our 3D perception. So these are the steps para tayo magkaroon ng single vision. If in case may disruption, dito pa lang, then magkakaroon, for example, dito, both one eye is deviated, one eye has suppression, one eye has amblyopia, then there is a possibility na pag ito, wala ng fixation, hindi na tayo magkakaroon ng fusion, hindi rin tayo magkakaroon ng stereopsis. Okay. So when you hear about binocular vision anomalies or binocular vision, ano yung unang-unang thought or what's the first topic na una-una mo agad naiisip? Can anybody tell me? For example, nabanggit ng isang patient sa inyo or ng isang teacher sa inyo regarding binocular vision. What's the first thought that comes to mind? Wala. When you hear binocular vision, okay, sino yung nag-raise ng hand? Okay, sige.
Right po, Doc. Both eyes po are working together to create a clear and single image po.
Okay, so yun yung first thought mo. How about the others? Kapag sinabi nila binocular vision or binocular vision problem, ano yung unang-unang naiisip ninyo? Okay, Kevin?
Bali po kapag sa akin po is kapag yung anomalies po is strabismus po yung una pong pumapasok po
Kaagad,
sa akin.
unang-una. Okay. Okay. How about the others? Meron pa ba? Okay.
Doc,
Laureline,
for me po, yung mga diplopia po, yung
diplopia.
failure to fuse images po.
Mm-mm. Okay. So, usually those are the very common na agad naiisip, especially on a clinical standpoint. For example, I am an optometrist. Then, bigla-bigla sasabihin ng isa kong colleague or a student or even a patient na parang nagkakaroon ako ng problem with binocular vision anomalies or if I hear binocular vision, those are the first three thoughts lagi. First, both eyes working together. Second is strab or yun yung usually laging common na anomaly, either yung in layman's term is the duling or the banlag. And the other one is the effect of the anomaly, either nagdo-double yung image, there is diplopia. Okay? So now, okay. So binocular vision anomalies, this occurs when there is a problem in the coordinated use of the eyes as a pair. So gaya na sabi ko kanina, if there is one problem, dun pa lang sa bifoveal fixation or dun pa lang sa alignment ng eyes natin may problem na, then it would create an anomaly in the development of the vision. Okay, so I'm not sure if nakikita niyo siya ng clear. Pero when it comes to deviation, it's usually categorized into two. Either heterophoria yan or strabismus yan. For heterophoria, it can be classified either compensated or decompensated yan, or can be classified based on its testing distance, if it's far target, intermediate, or near manifested yung deviation. It can also be classified based on the direction, if it's exo, iso, hyper, and cyclo. For strabismus naman, mas marami lang siyang classifications. It can be based on its constancy, if it's constant or intermittent. It can also be based sa test distance niya, if the strabismus is present at far, at intermediate, or at near distance. Pwede rin natin siyang i-base if sa sensory adaptation, is there a homonymous, which HARC is harmonious, it's harmonious, anomalous, retinal correspondence, or if there is suppression. Then it can also be based on its laterality. If it's unilateral, one eye lang ba yung nagde-deviate, or is it alternating? And last, it can also be based on its direction, if it's exo, iso, hyper, hypo, and cyclo. So, how do we differentiate aphoria from atropia? Ano usually yung number one tests na kailangan natin gawin to be able to differentiate aphoria from atropia? Any ideas? What's the number one tests na kailangan natin gawin to differentiate aphoria or atropia? Or it's the number one test that you should always be doing if in case if may suspicion ka na yung patient mo has binocular vision anomaly. Yes, Crisali?
Is it cover test po?
Tama. Even Alisa, tama. The number one test that you should always do is the cover test. Very simple lang yan, pero it gives you a lot of idea regarding sa case ng patient mo. You can actually either, if wala kang occluder, you can either do your hand. If may hawak kang paper, pwede mo rin siya. You can do it anytime, anywhere, para at least malaman mo kung yung deviation na suspected mo is phoria or atropia. Here, if we base it on this picture, what do you think is the deviation present? Isophoria, tama. So, is it, um, isophoria is shared by the two eyes kasi, no? So, no need to tell if it's right or left. Pero, para mas maging accurate yung recording ninyo, isophoria, if in case far target ang ginamit mo, you would record isophoria at far. If near target naman yung ginamit mo, you would record it as isophoria at near. Okay? How about with this one? Sorry. Wait. Okay. Nakikita na yung image? How about with this one? What do you think is the deviation present? Okay, tama. It's exotropia. Pero for recording purposes, if in case lang ha, pag nagpa-patient na kayo tapos sa case record, it would be better for you to record it completely. So in this case, since right eye yung deviated, you would then is it constant or is it intermittent? So pwede mo siyang i-record as constant exotropia at far, or is it unilateral right exotropia at far, para at least alam agad nung mag-check, is the deviation at the right eye, at the left eye, or is it constant, or is it intermittent, then is it manifested at far distance or at near distance. Okay, so heterophoria, this is the tendency of the eyes to move out of alignment when one eye is covered, pero usually after the obstruction, babalik na ulit sa normal position yung eyes natin. So this is just a tendency. So it is also called latent strabismus or latent squint. Then yung types is exophoria, esophoria, hyperphoria, hypophoria, and the cyclophoria. You are all familiar with exo and eso. For hyper, ano yung deviation? Saan yung direction? Upward, tama? Okay. How about hypo? Downward. Okay. And with cyclo? May idea ba sa cyclophoria? So usually it's not diagonal per se, pero it's the rotation from the anterior to the posterior position. More or less parang oblique movement, yes. Then, very common yung esophoria, exophoria. Now, I would like you to discuss naman sa inyo yung types of heterophoria in the clinical term. Tapos na kayo mag-bino lab, di ba? Last sem? Tama ba? Tapos, na-discuss sa inyo yung 21 VT. Di ba, na-try nyo na yung 21 visual steps? Can you remember kung anong VT steps natin makukuha yung foria? Yung foria measurement? May nakakaalala ba? Anong test number natin kinukuha yung foria measurement? Foria at far and foria at near. Wala. Di nyo na matandaan? O hinahanap nyo pa yung VT Bible nyo? VT. No, it's not 18, 12. Fusional vergences ata si, yan, tama. Tama si Vivian. So, it's 3, 8 for distance, Foria. How about near, Foria? Anong VT number? (13A) and 13A and dalawa yan. (13A) and 13B. Tama. So, 3, 8 is for distance. 3 is habitual correction. 8 is sa VT7 correction. 13A is habitual correction then. And 13B is subjective refraction na correction for near. So, yung mga yan, those are examples of binocular vision test para ma-measure natin yung FORIA na meron yung patient. So those are not just additional tests na pinapagawa namin. So kung ano man yung findings nyo dyan, it would help you identify kung ano man yung binocular anomaly na meron yung patient ninyo. So here, first off, if in case may basic esophoria yung patient ninyo, you would first look at your results from 3, 8, 13A, 13B. If yung esophoria na na-record nyo is similar yung value at distance and at near, then that would be a basic esophoria. Oh, sorry. If in case naman yung esophoria na na-record nyo is greater at distance than at near, then your patient may have distance esophoria or divergence weakness. If in case naman yung ESO is greater at near than at distance, then it is near esophoria or a convergence excess. If in case exophoria findings ka naman, then your value should be similar at distance and at near. That is basic exophoria. If in case yung exo mo is greater at distance than at near naman, then that is distance exophoria or divergence excess. If in case near exophoria naman, exo is significantly greater at near than at distance. So it can also be called a convergence weakness. For convergence insufficiency naman, this is actually characterized by your NPC findings. If your NPC results are higher than the normal na 8 to 10 centimeters, then you would classify the patient to have convergence insufficiency. So this is the basic definitions ng mga heterophoria natin. Pero for you to fully diagnose your patient to have these anomalies or these conditions, hindi lang 13A, 13B yung titignan natin. You would also look at the signs and symptoms na nararamdaman ng pasyente. Pero so far, naiintindihan ba to? So far, naiintindihan yung types of heterophoria? Okay. Next, we have the strabismus or yung pinaka-common na binocular vision anomaly. So it's also called topia or squint. Then it occurs when the visual axes are misaligned. So it's manifest. So kitang-kita mo talaga at the general observation pa lang na deviated na yung eyes ng patient. So it can be either be unilateral, one eye lang yung deviated, bilateral, both eyes, or is it alternating? Next, you can also classify it if it's constant or is it intermittent lang, periodic lang yung lumalabas yung deviation niya. Then it can also be concomitant if the angle of the squint is the same in all directions of gaze, if yung angle ng deviation niya when looking at the outward position is the same kapag tumitingin siya upward, downward, then that is concomitant. It's incomitant if the angle differs in the different directions. If, for example, malaki yung angle of deviation niya kapag nakatingin laterally, pero tumitingin siya upward, lumiliit yung deviation, then that is incomitant. Then, ito, gaya naman ng kanina, it can be classified based din sa deviation na XT, ET, hyper, hypo, and cyclo. Next, we have microtropia. So, based on the pangalan pa lang, you would know that this is a classification of strabismus as well. So, dito, ang strabismus na to, this is only less than 10 prism diopters in size. So, before mo masabi na yung patient mo has microtropia, kailangan all the following characteristics must be present. Hindi pwedeng isa lang yung present, hindi pwedeng dalawa lang. Dapat all must be met, all criteria must be met. First is the, sorry, naglag na naman. Okay, nakikita ba? Okay, so based on the definition, the angle should be less than 10 prism diopter. Then the VA of the amblyopic eye must be at least one line worse than the non-amblyopic eye. Then there should be eccentric fixation. What do we mean kapag eccentric fixation? Are you familiar with the term eccentric fixation? Are you familiar when we say eccentric fixation? Hindi. Or nakalimutan niyo na? Tama. Eccentric fixation, this is like, parang ano siya, defense mechanism ng patient. Kasi di ba, ang normal natin is head straight, eye straight, head straight, ganyan siya. That is the center position. Ang eccentric, if in case may binocular vision problem yung patient, either nag-head tilting siya or meron siyang mannerism na doon yung position niya para ma-maintain niya yung single binocular vision. Okay, that is eccentric fixation. Then HARC, or the anomalous retinal correspondence. So it should be detected by the Bagalini lenses. Ang HARC, this is, if you're familiar with Panum's visional area, di ba may area tayo sa ating binocular vision na kapag tumatama yung point of focus sa Panum's visional area, then it would bring about single binocular vision. Ang anomalous retinal correspondence, this is also a defense mechanism of a strabismic eye or an anomalous eye, na kahit yung points lumalagpas sa Panum's visional area, nagkakaroon pa rin ng single binocular vision yung patient. Okay ba? Naiintindihan? Okay. So since this is a microtropia, then dahil less than 10 prisms lang naman, may eccentric fixation naman siya, meaning there is single binocular vision. Usually, no treatment required naman to. Pero yun lang, kailangan all these conditions must be met kasi baka naman may angle of deviation nga siya, pero hindi naman amblyopic eye, wala naman eccentric fixation. Possible, mataas lang siguro yung phoria niya. So, you should classify it appropriately. Next, we have the nystagmus. So, Nystagmus is the regular, repetitive, and involuntary movement of the eye. This is yung constant movement ng eyes, either right to left or up and down, depende siya direction. Usually, the onset is in the first 6 months of life. Then, main types, the early onset. So, it occurs in the first 6 months, secondary to sensory visual defect. Nagkakaroon usually ng early onset nystagmus if may defect yung baby, di ba? If there is congenital cataract or if there is blockage for sensory vision to develop, yung eyes, naghahanap siya ng focus. Kaya, constant yung movement niya. Kaya nagkakaroon tayo ng early onset nystagmus. It can also just be idiopathic or congenital defect talaga siya upon birth. Then we have the latent nystagmus. So it is only seen kapag one eye is covered. Then usually it occurs in the first year of life. Then acquired nystagmus naman, this is usually caused by trauma or lesion affecting motor pathways. If magkaroon ka ng patient na may nystagmus, these are some of the clinical observations that you should take note para maayos yung recordings mo. First, general observations, you have to make sure is the posture or may eccentric fixation ba yung patient? May head tilting ba? Or is there facial symmetry? Then, take note of the movement or yung type of movement nung nystagmus. Is it pendular? So, when we say pendular, if you remember, alam mo yung grandfather's clock, yung movement na gumaganon siya. That is pendular. Or is it jerky, yung nag-twitch? Or is it a mixture of both? Then, the direction, is it horizontal? Is it vertical? Is it torsional? Or is it a combination? Then, the amplitude, is the movement small, moderate, or large? And the frequency, slow, ano lang ba siya? Is it a slow movement? Is it moderate or fast? Then, is it constant then? Is it intermittent or periodic lang? Kapag ba ina-occlude mo lang yung one eye or kapag at certain distances lang ba siya nagmamanifest? Then, the conjugacy, you would take note if both eyes are moving at the same time or parallel ba yung movement nila? Or is it monocular lang or hindi sabay yung movement? And does it have a latent component? Nag-change ba yung nystagmus kapag ina-occlude mo yung one eye? Or bumibilis ba yung movement niya? And the position of gaze. Does the nystagmus increase or decrease in any field of gaze or convergence? So these are some of the clinical observations na ita-take note nyo should you have a patient na may nystagmus. So we're done with the binocular vision anomalies. Ngayon naman, we will proceed with the accommodative anomalies. So, ang accommodative anomalies naman are brought about by inadequate amplitude or yung control of accommodation natin. There are 4 main types of anomalies. First, we have the insufficiency, the infacility, yung fatigue, and the accommodative spasm or the accommodative excess. So how do we differentiate them? Dito, when it comes to accommodative anomalies, we would differentiate them according to their signs and symptoms. So, ang symptom ng insufficiency, if magrereklamo yung patient ng near blur, hirap siyang magbasa sa malapitan. Ang infacility naman, ang complaint ng patient dito is nahihirapan siya mag-focus at one distance at a time. So, for example, if your patient is a student, if he or she is copying from the board, titingin siya sa board, nakikita niya yung lessons, isusulat niya sa notebook niya, so mag-shift siya ng focus, so mag-accommodate yung eyes niya sa reading. Then after niyang magsulat, titingin na naman siya sa board, then it takes a while for the eyes to focus na naman sa malapitan, ay sa distance, I mean. So ganun siya. So it takes a while for the eyes to focus from far, near, then mag-shift na naman doon, matagal yung waiting time. Then, accommodative fatigue naman, there is near blur towards the end of the day. So, usually ito, nagmamanifest na yung pagod ng eyes. At the end of the day, pagod na siyang mag-focus, pagod na siyang mag-accommodate. Ang accommodative spasm naman, this is a transient blur between distance or near vision. Then, accommodative amplitude. So, paano natin malalaman yung accommodative amplitude? This is done, usually, tinetest natin yan by the NPA, our near point of accommodation, or our AOA tests, yung VT number 19. Okay? So, if yung accommodative amplitude natin for insufficiency, based on the term insufficient, low or mababa yung amplitude niya. Ang in-facility naman, there is normal amplitude of accommodation. Ang accommodative fatigue, kapag inuulit mo yung tests, okay, so umpisa, first trial, then upon second trial, bumaba yung result, then on the third trial na naman, bumababa yung value. For accommodative spasm, there is normal result naman. For accommodative facility, this is done using flipper lenses. I'm not sure if you've seen a flip or if you've tried the flipper lens. Yun yung apat yung lens, tapos parang may handle siya. Tapos you shift from a minus lens to a plus lens, then babalik mo kay minus, babalik mo na naman kay plus lens. Have you tried that? Na-try nyo na, yung flipper lens. Have you tried it? Not yet. Hindi pa. Okay, pero available to sa specialty clinic ata. So I hope during pedia 2, matatry nyo siya. Kasi ano siya ang procedure kasi niya is start ka muna with a minus lens, hintayin mo mag-clear yung image, yung target mo. Then pag nag-clear sa minus, lipat ka sa plus. Pag nag-clear na siya sa plus, babalik ka sa minus. Repetitive testing. So, dito, malalaman natin yung ability ng eyes mo to shift focus. So, kapag insufficient yung accommodation mo, slow yung response mo sa minus lenses. If in facility naman, you have poor result overall. If in case sa fatigue naman, same din, bumababa yung result mo after repeat testing. Ang spasm naman, mababa yung response time ng eyes mo dun sa plus lenses. Wait lang. Okay. So last measurement na kailangan natin is the accommodative lag. This one is measured using retinoscope. Ituturo ko naman ito in detail sa pedia 2 since this is one of the accommodative tests na kailangan yung gamitin or you need it for pediatric patients. So yung result ng accommodative lag mo, usually doon natin malalaman yung treatment na kailangan. Sa accommodative lag, if makikita mo na mataas yung lag greater than 0.75, yung lag ng insufficiency, then you would prescribe a high plus on the spectacles. Ang if accommodative lag naman ng facility is normal, then you would just prescribe visual exercises para ma-practice yung accommodation ng patient. If in case naman yung accommodative lag ng fatigue is after much near vision nag-okay siya, it means you would prescribe accommodative inducing lens sa patient. If naman accommodative spasm, it gives you a low value than 75, then you would need negative lenses for this spasm. Itong accommodative lag, if hindi nyo siya gets, it's okay. Kasi i-discuss ko naman ito sa pedia 2 na. Okay, so that's it for module 7. Do you have any questions? Wala naman ba? So if no questions, magpo-proceed na muna tayo sa Module 8. Mabilis lang din naman to. Okay. So Module 8 is about the pediatric examination. This is just a brief overview kasi yung elements ng pediatric examination will be discussed in detail sa clinical pedia. So dito, introduction lang muna tayo. When handling pediatric patients, always remember the child protection protocol. So a child protection dictates na yung patient mo should always be accompanied by a parent or a guardian while they are in the consulting room with you. So dito, you as an optometrist or as an examiner, you are not allowed to be alone with the child in the examination room. Okay? Kasi in the past, there are experiences na syempre there are instances kasi minsan nahihiya yung patient since andun yung mother, baka takot siyang bumagsak sa visual exams, baka takot siya na mapagalitan kapag mali yung nasabi niyang sagot, or in case meron naman kasing optometrist na minsan intimidated sa mother kasi syempre merong mga mother na laging matanong. So the case before was hinahayaan na alone yung examiner with the child patient. Pero in today's society, bawal na po tayong mag-check or mag-examine ng pedia patient without a guardian present in the room. Okay? This is for the safety of the child, even as the safety of the practitioner. So if in case, sa ano naman, sa VECC naman kasi open naman tayo doon. Pero if in case in your own practice, meron kasing parents na, may gagawin muna, may mga errands, tapos babalikan na lang nila yung bata. Make sure na ikaw, as an examiner, you have an assistant with you in the room para hindi kayo alone ng bata. Or if in case wala kang assistant, just leave the door open para at least anytime pwedeng sumilip yung parent. So if may concern siya, pwede niya kayong makita now and then. And then the parents or the guardian's consent should always be obtained. Wala kang gagawin sa bata, especially if magsa-cyclodrops ka, nang hindi alam ng parent. Okay? Any test na gagawin mo, any tests na kailangan may effect or may side effect siya sa vision ng bata, the parent or the guardian should always be informed and dapat meron niyang written consent. For example, magsa-cyclodrops ka, syempre, ang effect nun, di ba, is dilated pupil. So, expect mo, sensitive siya sa light, mabilis siyang masilaw, hindi siya makakapag-phone, hindi siya makakapagbasa. So, before you instill drops, you should explain to the parent or to the guardian kung ano yung gagawin mo, kung ano yung effect niya sa bata, and ano ba yung expect niya, kailan mawawala yung effect ng drops. And if in case may magagawin kang special test, like for example, for binocular vision or for accommodation, explain mo na lang din sa guardian kung ano yung gagawin para at least hindi siya mag-worry about sa bata. Okay? Naintindihan po ba yung child protection protocol? Okay. So, ang American Academy of American Optometric Association has divided 3 age groups for testing. So dito, kinategorize niya yung pediatric group into age groups para at least mabilis kung ano yung mga test na ginagawa per category. So for example, kinategorize niya yung infants and toddlers aged newborn or at 0 to 2 years old as the first category. Second category natin is the preschool children aged 3 to 5. And last category natin is yung school-age children from 6 to 18 years old. So, kinategorize nila ito para at least mas mabilis yung testing procedures natin. Kasi syempre, di ba, meron kang test na appropriate siya for a school age, hindi siya appropriate for an infant. So, para mabilis yung flow ng examination. This is an example of the list or procedures na ginagawa natin sa comprehensive eye exam. If you're familiar with our case record na nasa VECC, ito lahat yung ginagawa natin. We do the patient history, the VA, refraction, accommodation, BV, ocular health. These are all catered to an adult patient. Pero kahit catered yan to an adult patient, all these examinations are still possible when it comes to a pediatric patient. Pero syempre, modified version lang tayo. So for example, we can still do the visual acuity on an infant, gaya ng any age, yun lang. Iba yung method na gagawin natin. So if you remember from our last discussion, when it comes to infants, makukuha lang natin yung VA nila using VEP or the visually evoked potential, or we can do the preferential looking tests. For preschool naman, we make use of symbol optotypes instead of name or instead of Snellen, or pwede tayo mag-letter matching or naming. For school age, since these are verbally, communicative children na sila, we can make use of Snellen charts or the ATDRS in visual acuity testing. Sa refraction naman, it is all, kahit infant yan, it is still possible to do refraction. Yun nga lang, limited testing ka lang. When it comes to infants, you cannot do subjective tests, so magre-rely tayo sa objective tests such as cyclorefraction or the near retinoscopy or our Mahindra technique. So this Mahindra naman, I will discuss it in Pedia 2 kung paano siya ginagawa. For preschool, refraction is still possible, pero you can also rely on objective test lang, such as distance retinoscopy, or this is our VT number 4, or you can make use of cycloretinoscopy. For school age, syempre mas marami ka ng options. You can use static retinoscopy, cycloretinoscopy, or if verbally communicative na siya, or sa tingin mo responsive na rin naman siya sa questions mo, you can also use subjective refraction. Siyempre, for accommodation, you cannot still do it for infants. Pero for preschool, magre-rely ka din ulit sa objective tests such as dynamic retinoscopy and MEM retinoscopy, which will be discussed during the clinical pedia as well. For school age, dito, syempre, mas marami ka ng options. So, you can do the retinoscopy tests, or you can do an NPA tests, NRA, PRA, and AOA, yung VT numbers 19, 20, and 21 natin, kung yung patient is kaya ng umupo behind a phoropter. Next, for binocular vision, all three categories, magagawa mo lahat ito. You can do cover tests, you can do Hirschberg, and you can do Krimsky tests. For stereopsis, syempre, for infants, since nagmamature pa yung vision, you cannot do a stereopsis test. Pero for preschool and school age, you can do the testing na. NPC test naman, you can do for all three. Syempre, modified targets ka. Sa infants, you can make use of bright lights or toys as your targets for NPC. Even for preschool, pwede kang gumamit ng toys as targets. School age, depende naman sa edad niyan. If pwede mo na siya lang gamitin na ng tip of the ball pen or yung line target, yung cardboard, I think, na ginagamit ninyo for NPC. Ocular motility, you can do version test and pursuit test sa infants. For preschool, you can do sa kids as well. School age, you can do all three as well. Color vision, syempre for infants, hindi pa sila responsive, so hindi mo pa magagawa yung color vision test. For preschool, kaya naman na siya, even for school age. Then, positive and negative functional versions, these are binocular vision tests. Syempre, for infants, not yet, pwede. Sa preschool, you can do it, pero modified or ibang tests yung gagawin mo. You will make use of step versions test or the Maddox swing. Itong Maddox swing, this is available. Meron tayo nito sa specialty clinic. This is parang toy lang siya. para mas mabilis makuha yung FORIA at NIR nung patient. For school age, once pwede na sila umupo behind the phoropter, you can do the 21 VT test na. So, ano ba yung recommendation ng AOA natin for the examination frequency ng bata? If the patient age is newborn up to 2 years old, maganda na ang interval na eye test nila is between 6 to 12 months of interval. If between 3 to 5 years old sila, at least once between this age, kailangan ma-check siya. If in case 6 to 17 years old or school age na siya, dapat before siya pumasok ng first grade, ma-exam siya para makita if may vision problems before pumasok sa school. And then after that, yearly na dapat para ma-monitor yung vision ng bata. Okay, so that's all for our module 8. So, mabilis lang siya. Do you have any questions or any clarifications? Wala naman? No questions? Okay, so if no questions, I will just be discussing ang schedule natin for this week and next week. So on December 6, which is this coming Wednesday, may quiz kayo on Module 7 and 8. This is just an online quiz lang. So this, kagaya lang siya ng Module 5 and 6. This will be available sa Canvas from 7 a.m. until 12 midnight. On that day lang siya available ha. So I don't want to entertain any late requests unless na lang valid yung excuse mo na bakit hindi mo siya na-take. I can consider. Pero kung for example, nakatulog ka lang, nakalimutan mo lang, though I think you are old and responsible enough to be able to take the quiz on the said schedule. Kasi you can take it naman during our class time para hindi mo siya makalimutan. Okay? And next week, Monday, December 11, magpa-finals exam na tayo para at least hindi tayo madagdagan ng mga gagawin before Christmas. So, agahan na natin siya. So, December 11 will be our finals exam. Coverage will be from modules 5 to 8. So, yung finals exam natin, it will be face-to-face. Sa school po tayo. Pero online, the exam will be available through Canvas ulit. So, bring your phones or your laptops na lang for the exam. Pero mag-exam kayo sa DCT 310, dun sa room natin. Okay? So, ulitin ko, this one is online lang. You may take it anytime. Basta on December 6 lang siya available. December 11, finals exam. Pero this one is face-to-face tayo. Pero bring your gadgets and your laptops kasi nasa Canvas yung exam. Any questions? Or any clarifications? Wala naman. Yes, Crisel.
Doc, bibigay niyo po ba yung PowerPoint?
Yes, ipopost ko siya
Thank
today
you po.
after. Okay. Any questions pa? Wala naman na? Okay. So if no questions, mag-attendance muna ako ha. Just say your name, just raise your hand, or type na lang sa chat box. Okay. Vivian Ancog? Yes, present. Alisa Andal? Alisa Andal? Okay. Nicole Apuada?
Present po.
Okay. Eunice Argenios? Okay, present. Jinky Ayo?
Present po, Doc.
Okay. Sarah Balde?
Present po, Doc.
Christine Balitaan?
Present po, Doc.
Okay. Alisa Bautista?
Present po, Doc.
Althea Bello? Okay, present. Janeline Biscocho?
Present po, Doc.
Christine Bonete?
Present po, Doc.
Karenina Cabral?
Present po, Doc.
Lori Lynn Cruz,
Present po, Doc.
Clarice Del Rosario. Okay, present. Alisa Drew,
Present po.
Jessica Gagi,
Here po, Doc.
Mary Jane Gratil.
Present po, Doc.
Okay. Abigail Lima,
Present po, Doc.
Ella Mangulabnan, Ella Mangulabnan, Dayan Mantua. Okay. Alisa Mapandi. Alisa, Mapan present. Okay.